Hello, I'm Dr. Rachel Paragallo-Urrutia, and I'm an OBGYN here at Reply, OBGYN and Fertility in Cary, North Carolina. I also work for the State Health Department as the medical consultant there. We have lots of patients who have questions during this time when we are all seeing what is happening throughout the world with coronavirus. And we wanted to take some time to respond to some specific questions you may have as your due date approaches or if you've recently delivered a baby. So specific to your postpartum care, our goal at Reply during this time is to try to minimize the amount of times you have to come out of your house and potentially be exposed to the virus, especially when you have to bring your newborn with you or expose your newborn at home. And so we have decided for right now to do all of our postpartum visits via telemedicine, unless we know of a specific concern that means that we need to do a physical examination. So everybody's postpartum visits, for the most part, will be scheduled via telehealth, and we normally do the postpartum visit around 3 to 4 weeks after delivery, because this allows us to try to find any problems that people may be having at a time when they're happening. Traditionally, postpartum visits have occurred about 6 weeks after delivery, and we think this is a little bit too late. So we'll be doing it at 3 or 4 weeks postpartum for most patients. Many of you may need to be seen about a week after delivery for various reasons, and most of these visits can also be done via telehealth. Some of these will be to check incisions if you've had a cesarean section, to check on your mood if you have risk factors for depression or anxiety after birth, and also to check on blood pressure. Now, blood pressure is a special case because obviously we can't check that via telemedicine. So if you know that you have a blood pressure issue, we would ask you to try to bring your blood pressure cuff to one of your prenatal visits so that we can make sure that it's calibrated with the instruments at our clinic. And that way, we can have you do your blood pressure checks at home and report back to us what those are. And that will help us see more people via telehealth. The other question we've gotten a lot of is about breastfeeding help and support. So breastfeeding in the era of coronavirus does have some caveats. One is that hopefully the majority of you will not be diagnosed with coronavirus postpartum, but if you are, there may be some specific concerns related to breastfeeding with coronavirus. It's doable, but it definitely takes even more attention to detail and infection control. And so if that is your situation, we will spend time helping you navigate that when you're in the hospital or if it happens postpartum. For most of you though, your breastfeeding help will be the standard, which is that everybody who delivers gets to see a lactation consultant in the hospital, and that is continuing at this point. And you should take full advantage of those resources in the hospital. Also, many doulas are offering online consultation, and doulas are frequently very experienced with breastfeeding support at home, and so you should definitely make use of that if your doula offers that. Finally, we do hope to be able to offer breastfeeding classes here at Reply remotely, although we're still working on how to do that. So if you currently have a breastfeeding class scheduled at Reply, I would recommend calling our front desk staff to see what the status is on that class. Many of our nurses and providers here at Reply have breastfed personally and are really skilled in knowing how to help with breastfeeding problems, and so we can definitely support you with breastfeeding concerns over the phone or via telemedicine after delivery. And we also have some resources available in lactation consultants in the community who offer telehealth visits. So please do reach out if you need breastfeeding support, and we can help troubleshoot and connect you to the right resources that you need. Thank you for listening to this, and I hope that you found it helpful.